You will have had a thorough in-depth consultation prior to deciding upon sinus surgery, and this will have focused on your symptoms and the problems you're having from your sinuses. We will have thoroughly evaluated your nose and sinus drainage pathways using a narrow telescope which is gently passed through the nose, and you will have tried multiple treatments in the forms of medicines for the nose, such as sprays and washes. It's likely that if you're on any blood thinners prior to an operation, we'll stop these to decrease the risk of bleeding after surgery. And usually any treatment you're using in the nose, such as the washes or the sprays, can safely be continued in preparation for surgery. Rarely I do give my patients a course of medication to decrease the size of polyps, which can help accessing the sinuses at surgery and also decrease bleeding and make recovery more comfortable afterwards. But apart from that, maintaining good hydration and a balanced diet is also sensible. The operation for sinus surgery is truly minimally invasive. That means there are no cuts on the outside. All surgery is conducted through the nostrils, and this allows excellent access to the sinus drainage pathways and the sinuses themselves. Usually sinus surgery is performed under general anaesthetic, that's with you fully asleep, and takes in the region of 1 to 2 hours. Rarely, sinus surgery can be performed with you awake using fairly new technology in the form of balloon catheters, which can be gently inserted into the drainage pathways and the drainage pathways widened. With formal sinus surgery with you asleep, the surgery involves removing any polyps which may be obstructing your breathing or lessening your sense of smell. Any inflamed tissue or areas of infection are cleared, and the sinus drainage pathways and openings are gently widened to improve airflow through the nose, but also to facilitate the delivery of medication, may they be washes or steroid sprays after the surgery. After your operation, you will wake up shortly after the operation's finished, and you will be moved to a recovery area where you'll be monitored in the immediate period to ensure you're stable to go back to your room on the ward. Once you're back in your room, you'll be looked after by one of my nurses who will check on you periodically. You'll be given something to eat and made sure you're comfortable from a pain perspective. Pain's usually minimal after this kind of surgery, and certainly straight after surgery your pain will be very well controlled. But thereafter, pain can be controlled with simple painkillers at home, such as paracetamol or ibuprofen. We will send you home with some stronger medication just to be used in case the pain is worse. Usually surgery is performed as a day case procedure. That means you go home the same day as the surgery is performed, as long as you have someone to pick you up and look after you overnight. After surgery, it's important that you start using medication which I give you after the operation the next morning. This will usually be saltwater washes, which can be used twice a day, the morning after surgery, to clean away any blood or mucus which may be in the nose. You'll also be given some steroid treatment to apply to the nose in the form of a spray or a drop, which again is started the day after surgery. After surgery, you can start the nasal washes the morning after surgery. This essentially helps clear the mucus and any blood which may have collected and dried in the nose, and help you breathe better and recover more quickly. You can also start applying the steroid treatment in the form of the sprays or the drops that I'll give you after surgery. It's important to take rest and take it easy after surgery, as exerting yourself, coughing, straining or heavy lifting may cause you to have a bleed after surgery. This is certainly the case for a few days, for 3 to 4 days after surgery. Beyond this, exercise is not recommended for the first 2 weeks, and then after that you can gradually return to normal exercise levels up to 4 weeks after surgery. You'll need around 7 days off work, although you can start working from home if that's an option around 3 to 4 days after surgery. Flying is limited to 10 days after surgery, and of course if there are any issues in the period after surgery, you can always contact me and I can address those either on the telephone, via email or in person. Yes, after sinus surgery I typically see my patients around 4 weeks after surgery. This allows time for the swelling in the lining of the nose to settle and for the nose to start opening up and start functioning normally. It also allows time for the medication which you will have been given after the surgery, such as the washes and the sprays, to take effect. At the appointment when I see you after surgery, I will again review your symptoms, but also importantly directly visualize the inside of your nose using the fibre optic camera in clinic to ensure that recovery is proceeding as expected. Of course, if there are any issues prior to your routine follow-up appointment, I would like to be contacted and I can either address any questions you may have via on the telephone or on email, but if there are any other concerns, then I would usually see you in person just to ensure that any of those concerns are addressed.